Hello everyone. So in last video we have seen the introduction, definition and the main etiological factors, that is virtuous stride of thrombosis. Now in this video we are going to see the different types of thrombi and then the morphology of different thrombi. Okay. So welcome you all. Myself Shweta Anande and I am learning in second year B.H.M.S. If you haven't subscribed to my channel, please do so and hit that like button. Also press the bell icon to get first notification of my videos for you. So let's get started. As you all know that thrombosis is a process of formation of solid mass in circulation from the constituents of flowing blood, and the solid mass formed in the circulation is called as thrombus. Okay, previously we have seen this. And then the etiological factors. Now there are different types of thrombi, that are cardiac thrombi, arterial thrombi, venous thrombi and capillary thrombi. So we will see them one by one. First one is cardiac thrombi. The cardiac thrombi are the thrombi which may form in any chamber of the heart and on the valve. The thrombi formed in any chamber, that is right, left, atrium and ventricle, four chambers of heart, and they may form on the valve as well. Okay, the common site for the thrombi formation is right atrium, mitral valve, aortic valve, and these are called as vegetations. Okay, you can see in this diagram as well. Then cardiac thrombi are mural thrombi. Mural means non-occlusive, that is they do not obstruct the whole lumen of the blood vessel, so they are called as mural thrombi. Then rarely large round thrombus may form and obstruct the mitral valve and is called as ball valve thrombus. Okay, it is a terminology which causes the obstruction of the mitral valve, and it occurs rarely, so the condition is called as ball valve thrombus. So this is all about your cardiac thrombus, that the thrombus which forms in any chamber of heart and valve, they are common in right atrium. The thrombus is mural thrombus, that is it is non-occlusive, and the rarely found clinical effect of cardiac thrombi is ball valve thrombus. Okay, then next is arterial thrombi. The arterial thrombi are formed in rapidly flowing blood in artery and heart. This arterial thrombi is common in coronary artery, cerebral artery, iliac and femoral arteries. The etiology, that is what is the cause of arterial thrombi, is endothelial injury, that is example is atherosclerosis. This we have seen in the triad of VENOUS, that is causative agents for the endothelial injury. The first event of VENOUS triad, that was endothelial injury, and the cause of endothelial injury was atherosclerosis. Okay, then the arterial thrombi is mural thrombi, that it do not occlude the lumen completely. Then the effect of arterial thrombi is ischemia, which leads to infarct, that is example is myocardial infarction. Okay, so arterial thrombi is it forms in rapidly flowing blood. Common sites of formation of arterial thrombi, then causes because of endothelial injury. It is of mural type, that is do not occlude all the lumen of the blood vessel. Okay, then effect ischemia, which leads to infarction. Then our third type of thrombi is venous thrombi. The venous thrombi forms in slow moving blood in veins. So arterial thrombi was in the fastest moving blood in artery, and venous thrombi is in the slow moving blood in veins. The common site of the venous thrombi are superficial varicose veins, deep leg veins, popliteal, femoral and iliac veins. These are the common site for formation of venous thrombi. Then etiology, why does it happen? Because it forms due to stasis of blood. Then next point is the venous thrombi is occlusive, that is it obstruct the lumen of the vessels and can propagate in both the directions. Okay, so venous arterial thrombi was mural thrombi, that is it was non-occlusive, whereas the venous thrombi is occlusive nature and it can obstruct the whole lumen of blood vessel, as well as it can propagate in both of the directions. Then effect of venous thrombi is edema, skin ulcers, poor wound healing and etc. So this is all about your venous thrombi. Then last type of our thrombi is capillary thrombi. It is a minute thrombi composed of packed red cells, and the etiology why this thrombi is the cause of capillary thrombi is acute inflammatory regions, then vasculitis, and DIC, that is nothing but the disseminated intravascular coagulation. So in short, the types of thrombosis is on the basis of the site of origin of thrombi, like it origin in heart, then it is called as cardiac thrombi, then in artery, then arterial, and so on. So these four are the main types of thrombi, that is cardiac thrombi, arterial thrombi, venous thrombi, and capillary thrombi. Then our next point is morphology of thrombi. As we have seen, the thrombi may occur in heart, arteries, veins, and the capillaries. The general morphological features of thrombi are as under. So the first one is grossly or microscopically, then second one is macroscopically. Let's first see the what are the morphological features grossly. So the thrombi may be of different shapes, size, composition depending upon the site of origin, whether it may be in the arteries, in heart, or in veins. Okay, so depending on the site of origin. Then arterial thrombi tends to be white and mural, whereas the venous thrombi are red and occlusive. So here the arterial thrombi is white, which means that the thrombi consist of platelets only, and venous thrombi is red, which means when the thrombus is forming, the adherent platelet, which are active platelets, and they attracts the RBCs and the fibrins plus WBCs towards them, and there is formation of red layer over the white thrombus, which leads to the formation of red thrombus. Okay, and why this red thrombi occurs in veins only? Because the arterial thrombi are formed in fastest moving blood, which do not allow the RBCs and other constituents to adhere to the vessel wall. But here in venous thrombi, the blood flow is slow, and that's why the RBC get adhere and form the red thrombi. That's why the arterial thrombi is white and mural, and venous thrombi is red and occlusive. The third microscopic appearance is mixed or laminated thrombi. They are also common and consist of alternate white and red layers. Please note that the white layer is of platelet and red layer is of RBC, fibrins, and platelets. Okay, with some WBCs. So the laminated thrombi, they are consist of alternate white and red layers, and these layers are called as lines of Jahan. Red thrombi are soft and red, gelatinous, whereas the white thrombi is firm and white. So this was all the gross appearance of your thrombi. Now we will see the microscopical appearance of thrombi. The lines of Jahan are formed by alternate layer of light staining aggregated platelets and admixture with fibrin, meshwork, and dark staining layers of red cells. The red, that is venous thrombi, have more abundant red cell and leukocytes. Platelets interrupt in fibrin meshwork. Thus, the red thrombi closely resembles with the blood clots in vitro. That is, it seems to be same and confusing with the red clots. The morphology, all about the morphology of thrombosis. In this video, we have learned about the types of thrombosis, that is four types, and then the morphology of thrombosis grossly and microscopically. So in next video, we will learn about the fate of thrombosis with its clinical effects. Till then, stay safe, stay healthy, keep learning, always dare to be wise, like, share and subscribe.